All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness. all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Good health is a journey, not a destination. Good evening. Welcome to a brand new episode of BMC Global Live, HILAL Health World, Nothing But Lifestyle. I am Jessila Mujib. In each episode of this talk show, we try to bring before you an expert doctor from HILAL Hospital to address your various health issues. Embracing a healthy lifestyle at any age can prevent heart diseases and lower your risk of heart attack and stroke. To discuss about a healthy heart, we have with us Dr. Mohammad Abdul Khader from HILAL Hospital, Manama. He is a consultant cardiologist, and now we will move on to him and know more about a healthy heart. So doctor, welcome to the show and thank you for joining us to discuss this topic, a healthy heart.
Thank you.
So doctor, what are the common heart diseases you come across in your OP nowadays?
Yeah, common heart diseases, the most common one will be heart attack. So then we have heart failure, we have sudden cardiac death, and we also have some disease of the heart valves. So these are common ones.
So doctor, now you mentioned about heart attack. So what are the causes and what are the symptoms of heart attack? Can you explain for our viewers?
Yeah, see the heart attack, this happens, the heart is like a muscle bag that has blood inside. So it will pump the blood, it is like a motor. So when it pumps the blood goes through the pipes all over the body. So but the blood is inside, that will not be able to send oxygen to the heart muscle itself because the muscle is thick. The oxygen cannot pierce and cross all the layers of the heart and supply oxygen. So the blood moves up in the big pipe called aorta. From there we have small branches that will come out of the heart, they will supply oxygen to the blood. So this is how heart itself gets blood and oxygen to pump. So whenever those pipes we call coronary pipes. The big pipe that receives blood from the heart is called aorta, and the aorta will have branches that supply blood to the heart muscle. Those are called coronaries. So these pipes are the most important pipes, and any blockage that happens in these pipes will lead to heart attack. So once the blood supply is cut off to the heart will only be able to manage for 20 minutes. So after that, the cells of the heart will start disintegrating. We call it necrosis and infarction. So when that happens, the full-blown heart attack will start and the patient will have severe chest pain, breathing difficulty, giddiness, palpitation, and they will come to the hospital. Unfortunately, sometimes it happens in a very rapid manner and suddenly the patient can collapse and fall in probably their workplace or in the house. So from there, for them to come to the hospital may take some time. And for us to save the patient, time is, we call it the golden period. The initial 3 to 4 hours is the golden period, and we call it as time is muscle. The more quickly the patient comes to the hospital, the more easier it is to save the patient. So, for the heart attack part, the blood pipes that take blood to the heart muscle, they have to be always flowing with blood. There should be no blockage. So, once the blockage forms, then we have the heart attack.
Then doctor, can you explain the causes that leads to heart attack?
Yeah, correct. So, just as I told, the coronary pipes, normally the coronary pipes are very smooth. There is no any ridges or any blockages inside the pipe. But as a person becomes more aged, and there are so many other risk factors, the pipes will start forming fatty plaques. If the pipe is like this, gradually the fat will get deposited. We call it fatty plaque. Then gradually the plaque will become big, and one fine day it will just close. So the day when it is trying to close, the heart attack will develop. But it does not happen within a few days or few seconds or hours like that. It gradually takes some months and years to happen. So the fatty plaque, there are two types of fatty plaques. One is stable plaque, one is unstable plaque. The stable plaque is like a mountain. So gradually when the pipes, coronary pipes are there, the fat is deposited. Gradually over a period of time, the plaques become bigger in size. Initially they will close to 30%, around 50%, 70%, and gradually to 90, 100%. So once the cross above more than 50%, there will be some form of symptom. So up to 70, 90% also, gradually the symptoms will increase. Very rarely we have patients who have 99% of block, but still they may not perceive some symptoms. They will be gradually moving on here and there, because it happens very slowly. Because it happens over a period of years, the heart tries to adapt. So this is a stable plaque. The stable plaque will give us some time. Example, whenever the heart pipe is getting blocked, people will be able to realize that, okay, I was doing so much physical activity all these years. Gradually now my power has started coming down. For example, I climbed 3 or 4 flight of stairs, staircase. Now I am not able to climb even 1 flight of stairs. Or previously I was able to go for shopping, do all the works and come back. Now on my way to the shopping I am feeling breathless, or some chest pain is coming. So this is the stable plaque that is gradually trying to close. So this is like a mountain. The other type of plaque is like a volcano. Obviously volcano is a scary thing.
Yes.
So the volcano, it will be trying to block the pipe, and the tip of the volcano, the tip of the block is very dangerous. Suddenly it will burst, that fatty material will leak out, and it will just close the pipe suddenly. That is very dangerous. And this unstable plaque will not even give time for the patient to even react or run for safety. So there are some triggers that can make the volcano burst. So one of the triggers is extreme amount of stress and tension. So you would have known when people become stressed, they develop heart attack. So this is one of the causes. During extreme stress, the tip of the plaque inside the pipe will burst like a volcano, fatty material will come out, it will close. There are other risk factors like binge eating. Some people will, all of a sudden they will go for some feast or something, they will eat whatever they can because it's a rare buffet or something. So we have had so many people, they will just have binge eating, after that they will develop heart attack and they will even die. So binge eating or too much of eating in one short time is very dangerous. So that will also make the plaque to rupture and cause sudden blockage of the pipe. And in some other instances, we have some flu or some fever, inflammation, some other reasons. Again, for example, even COVID. Yeah. After COVID also, the plaques can become unstable, it will just rupture and close the pipe. So again, heart attack will come. So these are two kind of plaques that can form, that can lead to the heart attack. So one should always be aware and alert. See, many people, what they have gastric problems. So they will get confused. They will have gastric problems for years together. So when the actual heart problem is coming, they will think this is our routine gastric problem. They will lose 1 day or 2 days after the long crucial time they will come. By the time they come to the hospital, their pumping power will be reduced. The heart would have had so much damage. Sometimes we can recover the heart's power to some extent. Sometimes you can never recover. So that is why we should always be on the alert, and we should also try to prevent the gastric reflux. So one of the important diseases of this generation is gastric reflux. People do a hard work from morning to evening, they become tired. By the time they come home, they'll have a bath, they'll either prepare food or they'll just eat the food somebody else would have prepared. They'll eat and quickly they'll lie down, they'll start digging the phone in the bed and after some time they will sleep. So whenever someone has food, they should not lie down for at least 3 to 4 hours. So at the very least, at least 2 hours. Because once you have food, there is always food, acid and air in the stomach. That will take 4 hours to empty. So the air will come out of the stomach through the mouth like belching. For example, what I advise always is, if someone wants to sleep at 10 o'clock, they should have dinner by 6 o'clock. Yes. So that is not possible in one day, but gradually they can give gradually they can start eating by 8 o'clock. After a few days, maybe by 7 o'clock. So gradually they have to train themselves. So when they have food, after up to 4 hours, gradually the belching will come out. And the food and the acid in the stomach will go to the intestine in that 4-hour period. So after 4 hours, the stomach becomes free and empty. Then they should lie down. Then they will have a peaceful sleep. There will be no gastric problem. And for lifelong, they will not have the reflux problem. So in future, when they have actual heart attack, they will be aware, no, I never have gastric problem, so this is actually heart attack. They will run and come to the hospital. So this is a very crucial advice which I would like to give to others. And there are so many risk factors for heart attack. We call it modifiable and non-modifiable. The non-modifiable is like age. Once we start aging, there will be an inherent risk for anybody to get heart attack. Compared to young, the old people will obviously have more risk. And there are other risk factors like genetic setup. Some people, some populations, some families, they have genetic tendency for heart attack. Especially the Southeast Asian population is more vulnerable. Compared to Westerners, compared to the Eastern population, the Middle East Asian population, they have a little higher risk for heart attack. And the people in the Mediterranean region have a lower risk for heart attack. So there is some environment, their lifestyle and dieting and genetic setup of the body, so many things play a role. And the other is, there is a type of personality called type A personality. These people, they are like very hyperactive kind of people, high performing kind of people. So they like to be always on their toes. They want to finish their tasks on time, they want to finish targets, and they will take quite very little rest.
Perfectionist.
Yeah, kind of perfectionist, yes. So these people also have a little higher risk for heart attack. So they have to learn ways to relax themselves. They have to take some rest, calm the mind, and take some time for their own health. So these are non-modifiable. Modifiable risk factors, we have a list of them. Diseases like diabetes, hypertension, high cholesterol, obesity, sedentary lifestyle, smoking. All these things come under modifiable because we can modify them. We can try to prevent these things and ultimately we can prevent heart attack. So these are the risk factors. And symptoms will be, see, when we have a wide range of symptoms for heart attack, the commonest symptom will be chest discomfort. And it is not very easy for everybody to differentiate the chest discomfort due to heart attack and chest discomfort due to gastric problem. Even doctors themselves sometimes may not be able to make a difference. And sometimes mere gastric problem will cause such a panic, the patient will think, okay, I have had a heart attack, I'm going to die. Just simple gastric problem, the reflux, GERD we call it, gastroesophageal reflux disease. The reflux can cause such a panic. And sometimes heart attack itself may not cause a big chest discomfort. Some people will say there was only mild chest discomfort. Then by the time they come to the hospital, we would have had big damage in the heart. So the main first complaint is chest discomfort. Usually gastric will be localized or a pricky type of pain here and there, on and off, it will come and go, it will be like that, especially on lying down. Because when you are lying down, the acid will go and hit the foot pipe. So at that time, they will have some pain. But cardiac pain, it will be like a generalized pain all over the chest, mostly in the central part of the chest, and typically as if it is crushing kind of or squeezing kind of pain will be there. And the cardiac pain, usually when the person starts walking or doing some hard work, the pain will increase. This is typical of cardiac. Okay. And the people who regularly go for a walk, they will be able to notice, we call it stable angina. So initially they will start their walking, regular walking, they will walk, and after some 5 to 10 minutes they will have some chest pain. That will compel them to take some rest, maybe some 1 or 2 minutes or 5-10 minutes. They will take rest. After that, they will be able to walk very nicely. They will very happily come and tell, doctor, I am having some chest pain. After some 5 minutes of rest, I am able to walk very nicely. And I will tell, this is the classic sign of heart attack. This is a form of the cardiac chest pain. The other thing will be breathlessness. The patient will feel so much of breathlessness, difficulty in breathing. And that is because during a heart attack, there is too much pressure build up inside the heart. So the heart is not able to receive blood from the lungs. So the lungs get flooded. Too much blood is there, stagnant in the lungs. So the lungs feel like a wet sponge which is soaked in water. So the lung should be free. It should be like a dry sponge. But here during heart attack, the patient will feel the lungs are like a wet sponge. It is so heavy, they are not able to have that free feel of breath. So they are just they will have air hunger, or they will find it so difficult to breathe. The other symptoms will be back pain. Back pain, the upper part of the stomach can have some pain, neck pain, and even jaw pain. We had one patient who had only jaw pain. There was no other pain. Then we did serial ECGs, we found out. Okay. And the pain usually from the chest, it will radiate towards the left arm. Sometimes towards the right side, rarely to the right arm also. So commonest chest discomfort which radiates to the left hand. And this is the commonest symptom. And for women, there can be some atypical symptoms which are not the routine symptoms. For some young people or women, they can have too much of belching, too much of air coming out of the mouth, burping, and some gurgling sensation, discomfort in the stomach, low backache or back pain in the upper back or giddiness. All these things can be there. Palpitation, and one is loss of consciousness. They can just lose consciousness like that. Okay. So all these are the symptoms, and all these are the risk factors and diseases that can cause heart attack.
Okay, doctor. Now you mentioned about diabetes as a risk factor of heart attack. So can you explain how diabetes affects heart attack?
Yeah. So in diabetes, what happens is, normally for all humans, whenever we have food, the food is made up of carbohydrates, proteins, fats, and we have vitamins, minerals. The carbohydrates, predominantly we have rice, wheat, and all these products. So when you take food, it will get digested in the stomach and intestine, and our intestines will break the food into simple glucose and related molecules. They will easily get absorbed through the intestine into the blood, directly it will go. So once the glucose is circulating in the blood, our body will also release insulin. The insulin, it will also get secreted through an organ called pancreas, which is behind the stomach. So the insulin is secreted by beta cells in the pancreas, that is a leaf-shaped organ behind the stomach. The insulin will get released, it will catch the sugar which is in the blood, it will try to push it into the muscle. And then the muscle will move about and burn the calories. This is how normally it happens. But in diabetics, what happens is, the beta cells of the pancreas, they will gradually start losing their power. They are supposed to lose their power at 80 years, 70 years of age. But because of bad, unhealthy lifestyle, even at a younger age, we are losing the beta cells. So once there is loss of beta cells, our insulin production is less. So when the beta cells, when we start losing our beta cells, the insulin production is less, and as a result, very less insulin is there. So too much of sugar is circulating in the blood. The sugar is trying to enter the muscle, but it does not have enough insulin to pierce the muscle and enter the muscle and get burned as calories. So, when there is too much of sugar, this sugar is bad. See, anything above anything in moderation is good. Too much of extremes is bad. So, low sugar is also bad, too much of high sugar is bad. So, when the sugar is too high, these will get converted into fat and they will get deposited in the body, in the abdomen, stomach or in the limbs, and also inside the liver. We have fatty liver and in the intestines, everywhere fat will get accumulated. And we also have some chemicals called advanced glycosylation end products, AGE. These products will deposit everywhere also, and so many chemicals, they will lead to the blocks getting formed in the coronary heart pipes. So, gradually they will start blocking, and one fine day all of a sudden they will close totally. So, this is the problem with diabetes. And the other diseases in hypertension, what happens is, see, normally heart pumps blood. So, with each and every pumping, one jet of blood will go to the pipes. So, the blood pressure, there are two numbers, one upper number, one lower number. The upper number we call it systolic BP, the lower number we call it diastolic BP. When the heart is pushing it with full force, when the jet is moving, the blood jet is moving in the pipe, it will cause a surge in BP with every heartbeat. There will be a spike in the BP, that is the upper number. So, this extra pressure is required to take the blood and oxygen through the muscles, through the body, it has to pierce and go. And when the heart is, once it will pump and it will relax, again it will pump, it will relax. So, when it is relaxing, the pressure comes to at least around 80 or 70. The pressure never becomes 0. Once the pressure becomes 0, it means the person has died. Only when we are not alive, the pressure will become 0. As long as the person is alive, there will be one upper number and lower number, the systolic and diastolic. So, as the people become aged, their blood pipes will become more harder. See, the blood pipes should be elastic, smooth, so that they easily receive the blood from the heart. So, as the blood pipes become more and more hard, there is no space for the pipes to receive the blood. So, the heart has to push more with more power, more force. So, as a result, the shooting up will happen, the too much, because the blood pipes are not elastic, they will not expand while receiving the blood, they will be stiff. So, at that time the BP will shoot up too much. Too high BP will cause damage to the tissues. Imagine some 10 people are coming and hitting one person, so they get damage, physical damage. Just like that, the too much powerful blood, when the blood pipes are not elastic, it will come and hit the pipes, hit all over the body, it will cause damage. And simultaneously the heart, if normally someone goes to a gym, they do all the workout, they will become more muscular. Similarly, in a hypertensive patient or a patient with high blood pressure, when the heart is pumping blood, it has to push with more force, because already there is too much resistance or block kind of difficulty for the blood to go to the pipes. The heart is pushing too much blood. So, at that time it is like too much exercise for the heart. So, the heart muscle becomes thick. So, as a result, the heart muscle becomes thick, and this too much thickness will lead to more problems. Once the heart muscle is too much thick, the space inside the heart itself become narrowed. So, there is no space to receive the blood from the lungs and push it to the body. So, as a result, there will be too much pressure build up inside the heart also, and all these things will lead to heart attack. So, the common diabetes and hypertension, they work in this manner to bring about the heart attack.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Now, doctor, can you explain how high cholesterol affects our heart?
Yes. So, the other thing is cholesterol. We have so many subtypes in cholesterol. We have good cholesterol, we have bad cholesterol. One thing is called triglycerides. One is very low density cholesterol. So many subtypes. The good cholesterol is like a savior. It will spread all over the body. It will try to prevent any blocks forming anywhere in the pipes. So, this is a very good chemical in the body. But the only sad part is to increase the good cholesterol, only walking is the best way. There is no other easy shortcut. Tablets are there, but tablets will not help very much. And some fish oils, the cod liver oil, fish, these things will help. But walking is the best way to increase the good cholesterol. And the other one is the bad cholesterol. The name of the good cholesterol is HDL. It should be around 20 to 60 milligrams per deciliter. And the bad cholesterol, its name is LDL, low density lipoprotein. The good one is high density lipoprotein. This LDL is a bad one, low density lipoprotein. So, the LDL, what happens is, see, major part of the cholesterol is produced inside the body itself. The liver will produce cholesterol. Some part will contribute through the diet. But that is also important. That doesn't mean we eat whatever we want. Anyways, my genetic setup is there. Why do I bother? No, it's not like that. So, we have to have moderation in diet. And see, you would have seen so many people, they eat so much, they are very fat also, but some will not have heart problem at all. Some people will be very lean and thin, they will eat little only, but they will ultimately have a heart attack because there are so many chemicals at different levels. We call them leptin, adiponectin, so many, they are discovering more and more. So, the bad cholesterol, it is also produced in the liver, and normally it will circulate all over the body. It has its own functions. For the cell membrane, all the membranes, they require cholesterol. For you to produce your own cells in the body, you need cholesterol. But when the level exceeds too much, the bad cholesterol will combine with oxygen and it will form a bad poisonous chemical. That chemical will go and start forming the fatty plaque that blocks the blood pipes. So, that fatty plaque only will produce either a stable plaque or unstable plaque. I told you, the stable plaque is like a mountain. It is just there, always trying to block, gradually increasing in size. The unstable plaque is like the volcano. So, it is gradually increasing. At the same time, the tip is very dangerous. The block, the volcano type of the unstable plaque, it has a tip which can easily rupture and the fatty material will just close the pipe anytime. So, this is the problem with the cholesterol. And all these diseases like diabetes, hypertension, obesity. Obesity, there are two types of obesity. One is apple shaped, one is pear shaped. Apple shaped obesity, the limbs will be more fat, like it will, there is more fat deposition in the limbs and little bit in the stomach also. That is less harmful. I won't say it is very nice type of obesity. Any obesity, any overweight is bad only, but the apple type is less harmful. But the pear shaped is more bad because the pear, when you see the pear fruit, the upper part of the pear will be small, lower part will be big. Similarly, those people will have more fat accumulation in the stomach, but their limbs will be thin. These type of people will have higher risk for heart problem. The stomach fat is one of the most dangerous tissues. It will release different types of poisons and these will go and block the pipes. So, this is there. So, diabetes, hypertension, cholesterol, obesity, and one more is smoking. So, smoking we all know it is bad, but the one who gets addicted to smoking, it is not possible. We have seen so many people who have a heart attack, they put the stent. After few hours of putting the stent, they will tell, no, I have to smoke, otherwise they will go crazy and they will just, they can't survive only. So the brain, once it gets addicted, it is not easy. It will take lot of hard work. It will take lots of motivation from the family, friends. And smoke, see the cigarette, it has, one is nicotine. Nicotine, it will make the person get addicted to the cigarette. And also, it has so many chemicals, so many hundreds of chemicals. One of them is coal tar. All this coal tar, nicotine, so many harmful chemicals. These will cause lung problems, cause blockages in all the pipes, not only heart, the brain, and it will cause ulcer. All over the body will get damaged. Smoking, all of us know, but the one who smokes, they too know, but it is not easy. Nowadays, some medicines have come. Some medicines, they can reduce the craving for the smoking. They can help the person to come out of it. Medicines have come. We have nicotine chewing gum also. Some people have benefit with nicotine chewing gum. And we also have the alcohol. See, alcohol, there are some studies that say limited amount of alcohol helps for a healthy heart. But the problem is, it is not easy to always maintain the low level. Generally, when a person is stressed out or they become very happy, they will lose the control. And the problem with alcohol is, person to person, they have a genetic tendency. Some will drink gallons of alcohol. They won't have a big damage. But some will take very little alcohol. That itself will damage them more. So, every person has a different threshold for the bad effects of alcohol. And in the long run, it is not easy to control. Many people will get addicted to alcohol. That will anyways ruin their health ultimately. So, these are the risk factors and signs and symptoms of heart attack.
So, now you described about all the risk factors. Now, an important query is, can we prevent heart attack?
Yes, heart attack is one of the preventable. For the major part, it can be prevented very much. And the prevention is by addressing the problems. So, the best thing is for us to have a regular health checkup. So, normally we have seen people who they just never go to any hospital for checkup for 10 or 15 years and they are very happy that I have never come to hospital. No, we should at least check our sugar and blood pressure, cholesterol once a year, at least once a year. So, this will help us to save some time. So, for example, someone develops high sugar and it is very high and the sad part is many people won't know that they have the sugar. There won't be any symptom at all. The sugar might be 200, 300, that will go on for one full year. That itself will produce some permanent damage. So, one is regular health checkup. The other part will be diet and healthy lifestyle. So, in diet, I always advise my patients not to take junk food. The moment we say not to take junk food, they become very sad. So, typically like all the French fry, pizza, burger, all the products made up of maida and the sugary drinks, all the
processed food.
Processed foods. These things will have more sugar, more salt, all trans fats. So, all these things, as much as you avoid, it is best. Then they will ask, what else can I eat? So, see, we can eat all fresh fruits and vegetables. See, for diabetics, they cannot eat sweet fruits, all mango and all jackfruit, ripe banana. These things, they will ruin the dieting, they will ruin. But they can take fruits that are not very sweet, like strawberry, green apple. There is unripe papaya. You can cut unripe papaya, you can cook and eat. There is unripe guava, green apple, strawberry, avocado, and some pomegranate which is not very sweet. So, similar kind of fruits they can take. So, all the berries like blueberry, strawberry, blackberry, these things. And all green leafy vegetables, all these things have antioxidants. The benefit and they have fiber. See, the antioxidants, they are so many chemicals, they will enter the body, they will pull out the poisons inside the body and they will neutralize the poisons. And they will make you stay healthy, they will keep you young for a long time. For a healthy, glowing skin, healthy body, the fruits and vegetables play a major role. And fiber. Dietary fiber is there in all fruits and vegetables. So, dietary fiber, when we take it, the dietary fiber, if there is some extra sugar, it will bind to the extra sugar. It will prevent too much sugar entering the body. And too much fat also, it will prevent too much fat from entering the body. So fiber has so many benefits. And this is about dieting, and there is also one type of diet called DASH diet for hypertension. Dietary modification we can do, we call it DASH diet, that is for hypertension, where they have found out that using foods that are more in potassium, they will help to reduce the blood pressure. And foods that have calcium also, they will help in reducing the blood pressure, like curd, milk, these things and curd has what is it? Yogurt, curd, these things have probiotics. They have good gut bacteria. So all these things play a major role. And so this is about dieting. And walking, walking is one of the most important exercise. Better than walking, I would say swimming is the best exercise. If we don't know swimming, at least walking in water will help.
Okay.
So because see, whatever exercise you do on land, there will be gravity. So every knee joint and all the ankle joint, all the joints will have pressure and friction. But in water, the water will lift your weight. It has buoyancy. It will lift your weight. It is like flying. So there is no friction or any stress on the joints. You give only work to the muscle, and the joint in a healthy manner, it will also gain more power. If we don't know swimming, we can at least do water walking.
That's a good information for us.
Yes. So, but they can try to learn swimming also. But the only problem is you can't go for swimming in a winter season. So the cold season, unless you have a hot water swimming pool, which is very rare. In summer, the 6 months you can utilize that time for the at least even say about 1 hour of session, swimming session, at least 2 times or 3 times a week will make a very big role. As for walking, see, there are 2 types of exercise. One is called endurance, one is called resistance exercise. Normally when people go to the gym, they will lift heavy weights and do to become more handsome or beautiful, they will do like that. They will, when the lifting of the weights happen, there will be too much pressure in the chest. That is not a very good thing for the heart. But instead of that, the lifting of the weights, we call it resistance exercise. So that is not a very great thing. Whenever there is too much pressure in the chest, the heart will find it difficult to push blood into the blood pipes because there is too much pressure in the chest. But the endurance exercise is very good. Endurance is like typical walking or passive moving of the muscles where there is no extra weight involved. So what all the American associations, what they advise is at least 20 minutes of walking, at least 20 minutes. The more you walk, the more healthy it is. So you can walk for 40 minutes, 60 minutes. We have our professors who advise walking 1 hour in the evening, 1 hour in the morning, which may not be possible for many. But the one who had a stent in their heart, who needs that proper thing, we have patients who do that also. And the more they walk properly, meticulously, regularly, lesser is the chance for them to have a heart attack. See, after any heart attack, they will give medicines. Medicines will only help to some extent. But the major part is our dieting and our walking. So and the speed of the walking. See, it should be a brisk walk, not like I'm also walking and they just walk in a park with phone. They stop so many times. Some kids will run across. So the walking should be continuous. You have to try to prevent the breaks in the walking. And the first 20 minutes you walk, that is the brisk walk. At the time, the extra glucose will be burnt, calories will burn. After 20 minutes, extra fat will also start burning up. So you will get the added benefit. So we have covered dieting, brisk walking, and nowadays we see so many people, they have a sedentary lifestyle. Previously, they thought that smoking is the most dangerous thing for the heart. Now they have come up with the point that sitting in the same place for a very long time, especially IT professionals, anyone who is in a computer related field, sitting in front of the computer for such a long time, hours together. See, once they enter the computer, everybody will forget the time. Till we finish it off, nobody will remember. So sitting in the same place for a long time, that itself is known to produce heart attack. It is very risky for the heart. What we should do is keep an alarm at least 20 to 30 minutes. Once in 20 to 30 minutes, you keep the alarm. So you move about, you drink water and come once, you go and have a phone call and then come, you go and speak to someone and come. So you have to break the sitting cycle. And so that is one important thing. And
now, doctor, can you explain about how stress affects our heart health?
Stress, the present time stress is very high for all of us. And when I say to patients, you have to avoid stress, then all of them ask like there is no life without stress. What to do? Every day stress is there. Either something related to family or job or some financial crisis. Stress is always there. It has become a part of life. And the problem with stress is a well-known factor for cardiac disease. And the stress, it is very difficult to measure. We don't, for blood pressure you have a machine, for sugar you have a machine, sure. But for stress there is no machine. There are some questionnaires that will tell you whether the person has stress or not. And there are some people, they themselves don't realize they have stress. That also we have seen. And we have the people called type A personality. So the stress, one thing is hard to measure the stress, and which is also hard to know which person will have more damage with the same amount of stress. For some fixed amount of stress, one person will have too much damage, one person will not have that much damage. So we have to learn coping mechanisms, coping skills. When people have too much stress, what they will do is they will go for some form of addictions. Either they will, so many people will say, doctor, when I have stress, I just smoke one cigarette, I'm very happy. So, or they will tell, I take some bad lifestyle only it will end up with. So, see, spending time with family will reduce stress, and walking, physical activity, that itself will reduce stress. There are also some tablets which will not have addictive nature. Those tablets can be used sometimes by the prescription of the doctor, if required. And proper sleep should be there. People who have less sleep will have more stress. Ideally, we should sleep for at least 7 to 8 hours per day. So what people commonly do is they will finish the duty in the evening, they will come home, they will have a bath, so they will eat food. Either they will have to prepare the food and eat, or someone would have prepared, they will have to eat. And after eating, they will become too tired, they will sit and like a couch potato, they will watch something on the TV or phone. Then they will go to the bed, again they will lie down, again they will dig the phone, and then they will somehow sleep. The problem here is, first we have to give a gap between food and lying down. So at least 3 to 4 hours. That will prevent the gastric acidic problem. So once you have GERD, gastric reflux, even when you sleep, the acid will hit the food pipe. So there will be some form of heartburn, some problem. So the person, though he is sleeping, the brain is not actually resting. There is a war between the stomach and the brain. So the sleep is not a peaceful sleep. Even after they sleep and wake up, they will feel tired. So the sleep should be a nice deep sleep where you have that refreshing nature. So half the people, because of this bad lifestyle, they have a very bad sleep. They don't realize that the sleep is bad. They think, no doctor, I have slept very nicely. Then the other day morning, they will have a headache, their BP will be on the higher side, they will have some palpitation, all symptoms will come. So it starts with dinner time. During dinner, it is better to sit with the family and eat. That is one big stress reliever. We have more communication among the family members, and try to avoid screen time as much as possible, physical activity. And see, after dinner, you can do some soft walking. People think after dinner we should not go for a walk, but actually we can go for a walk after dinner. That will help in easy digestion of food. That will help in the muscle, insulin resistance of the muscle. It will help the insulin to push sugar into the muscles. It will burn more calories, and it will prevent the gastric reflux problem. It will prepare your body to sleep. It will make your brain a little tired, so it sleeps well. So instead of that, if we dig the phone, the brain will become alert. It will process too much, it will absorb too much information, it will process too much information at night, and ultimately you won't sleep properly. They will have all sorts of dreams that will spoil the sleep. And ultimately again early morning they have to see, you might have noticed after sleeping, when you try to wake up, the body feels so heavy. You are just not ready to get out of the bed. You feel as if some 100 kgs of extra weight is there in the body. And the people will take so much time to sit to and then move about and then get ready for the job. So the stress, all these factors will try to prevent the stress, and eating a healthy diet also contributes. Avoiding too much coffee, too much chocolates and all these ice cream junk foods, and going for the fresh fruits and vegetables, all these are interconnected. That will reduce the stress. And if they have too much stress, they have to come to the doctors to try to make some plan, life plan for them, which suits for that every individual separately. So everyone, see, I have had people who have long night duties. Night duty itself will produce stress.
Yes.
Yeah. So, and after that night duty, in the morning they will come home, have something, they'll eat something and then quickly lie down. Then they will come with severe gastric problem. And sometimes, some people what they will do, they will follow my advice properly, and they'll, doctor, I eat dinner very properly at 6 o'clock and then at 10 o'clock I lie down. And then again the gastric problem has come. Then I will start, what did you do on the holiday? After lunch, what did you do? Yeah, yes doctor, after lunch I lie down for some time, and again the problem started. So once someone eats something, even little bit of fruit, milk, all these things will produce acid in the stomach. So little bit of fruit and milk, whatever they have, after that if they lie down immediately, the acid will hit the food pipe. If it causes an ulcer, that will be there for months together. It may not heal quickly. So then they will have that recurrent pain all over. Each and every time they have to run to the hospital, do ECG, blood test, everything. Then they will tell, no, this is only gastric problem. So much of time, money is lost. So all the simple tips can help.
Doctor, sometimes we hear about sudden cardiac death. Can you explain?
Yes. See, for sudden cardiac death, see, the heart, just like any house, we have electrical system and plumbing system. So all this time we were speaking about the plumbing system. The problem in the plumbing system can cause the blockage for blood and oxygen that will lead to the heart attack. And once the heart attack is happening, the heart, see, normally it has to pump smoothly. With every heartbeat, there is a good pumping of the heart. So when the heart attack is happening, the heart is not pumping, rather it will be shivering. It is not pumping in a smooth manner. So when it is shivering, the blood inside the heart is not moving anywhere. It is just stagnant in one place. So if that situation happens, we call it as VT or VF, ventricular tachycardia or ventricular fibrillation. Some people have this tendency. The moment some oxygen is reduced to the heart, suddenly the heart will go for VT and VF. So that is a very dangerous and critical situation. So once the VT or VF has happened, there is no blood going to the brain. So the brain will allow 3 minutes maximum, just 3 minutes. After 3 minutes, the brain will go for damage. If there is no, the brain is a very soft, sensitive organ. It will only tolerate loss of oxygen only for 3 minutes. Maximum within 3 minutes, it will go for unconsciousness. The patient will fall down. And once, see, for example, this situation happens to some patient inside the hospital. All of us are ready. The monitor will be there. The team is there. We can do chest compression, CPR, shock, something, and save the patient. We call it advanced cardiac life support. But so at least we can try to save the person within the critical golden period. Imagine this happens in a roadside or somewhere in a village, inside the bathroom or somewhere, the person will get stuck. Nobody is there to help. If someone who lives alone in the house, all of a sudden they have this, yes, that's all, then that is a problem. And once there is a either partial or permanent damage to the brain, it is not very easy to reverse back the damage. So that is why we call it survivors of sudden cardiac death. So see, all the factors should be favorable for the person to survive the sudden cardiac death. So in one manner, what happens is the heart starts shivering and the blood is not moving to the brain and the blood is not circulating all over the body and the person dies. That is one manner. one situation is the blood pipes are smooth. There is no problem at all in the blood pipes. But the current, there is some abnormality in the patient's heart. So this is a genetic problem. So there is a genetic problem, and there are ways to find out this genetic problem also. We do ECG, we can do echo test, we can do some other test to find out if the person has a risk for sudden death. There are diseases where early morning alarm can provoke a cardiac storm, VTVF, and the patient will die just because of alarm, sudden loud ringing alarm noise. Okay. That is why we should advise children not to shout or scream when someone is sleeping. Sudden loud noise while sleeping can provoke this, we call it arrhythmia, the disturbance in the heart rhythm. And sudden jumping into cold water, that can either drop the heartbeat too much, or sometimes paradoxically it will cause the VTVF, and that is also risky. And just mere stress itself can cause this electrical storm, VTVF, and patients can die. And recently, after the COVID, we would have seen so many people, young people, no smoking, no alcohol. I see every week at least 2 or 3 people who come and say, doctor, my colleague, he was a very normal person, no smoking, no alcohol, 35-year-old, he was working, all of a sudden he collapsed and fell down, he died, that's all. Or one person who was waiting to go for walking in the house, he collapsed, fell and died. One guy after walking, he died. So there are so many situations. One guy in the sleep itself, he died. So many things are there. What happens in COVID and some other flu is, normally there will be a viral infection. You will have cough, cold or something, or fever. Sometimes there will be no symptom also. So once the virus comes and attacks the body, and the virus itself will die. After 4 or 5 days, the virus itself will die. But the body will think that some damage has happened or the virus is still there. It will try to attack the virus. It will produce so many chemicals that will try to attack the virus, but already the virus has died. So instead, the blood becomes thicker. The blood starts clotting inside the blood pipes. So all of a sudden, blood will start clotting, and all of a sudden it will go and block either the brain or the heart or the lungs. Most important is the lungs. Initially, when the first wave of COVID came, we had so many sudden deaths. All the doctors were perplexed why people are dying all of a sudden, and we used to treat them for 1 week in the hospital. After they have become better, they will go home and they will die. Then the patients, attenders, the family people, they will tell, doctor, the treatment was so nice, patient became very much better. Then how the patient died? Then they did autopsy, they did the postmortem, and they found out that the blood in the lungs, the blood goes to the lungs through pipes called pulmonary arteries. There the big blood clot is there, and these people develop the blood clot and all of a sudden they die, during sleep especially. So then the guidelines came, they started putting oral anticoagulants, blood thinners. So typically after COVID, they will at least put blood thinners for 2 to 4 weeks. Then only, and they will do a D-dimer test, blood test, that will tell us whether the blood is having a risk for too much of clotting or not. See, normally blood should clot when there is a cut in the body or the blood is leaking out. The body wants to seal the blood loss. So clot should form. But when the blood is normally flowing inside the body, blood should not clot. So it should be in a liquid manner. So the virus will confuse the blood and make it clot, and the person will die. So we have the blood test to check if such a problem is happening, and based on that we put medicines. So during the second wave also the same thing happened. Of late, since last 6 months to 8 months, again we have a smaller wave which is there, but probably we all have developed some immunity through vaccine and through natural infection. So now it is less, but during first and second wave it was too much. So one is the VTVF, one is the blood clot that can suddenly clog the pipes, the patient will die. And there is also some condition called dilated cardiomyopathy. So the heart becomes like a balloon and it is big. So these people also have a higher risk for sudden death. So already when the heart is big, the clots can form inside the heart itself. Because it is so big, the blood is stagnant, and suddenly this blood will get pushed out, it will go and block anywhere, it will die. Patients may die. And yeah, these are the common.
Okay. Doctor, you told about now after COVID, sudden death happens, and you prefer this blood thinning medicines.
Correct.
So, do you prefer this type of treatment for the young people also?
Yes, yes, definitely. See, any person who has a flu and we have a suspicion that this person is going to see, not everybody will have a blood clotting.
Yes.
You can't put blood thinner for everybody, then there will be higher risk of bleeding.
Yes, yes.
That thinner will make the blood thin. So
How do you know then?
we examine the patient, we have the blood investigations, and we have so many blood tests that will pick up the tendency for clotting. So gradually when we do the test, if it has, and the problem is, even if you do the test, sometimes by the time the report comes, patient still can, the report may take 1 day to come sometimes. So within that 1 day also patient can land up with trouble. But see, we can fight with nature to some extent. We cannot change fate or nature altogether, but the blood test will help. The blood test will help us to find out whether the blood is going towards clotting. We call it D-dimer. And once the D-dimer levels start increasing, we will put the patient on blood thinner. Then we will do serial D-dimer monitoring, maybe once in 3 days or once in 5 days. Then gradually we will try to reduce. See, the D-dimer will become normal. After maybe 2 weeks or 4 weeks, the D-dimer will start coming down. By the time the D-dimer starts coming down, gradually we can reduce the blood thinner dose and we can stop. So it is not like a lifelong tablet. It is only for maybe 2 to 4 weeks or sometimes 6 weeks. So see, some people, that's what, for example, for 100 people who get a flu, maybe 95 to 97% of people will not have this clot. Just 1 or 2% people will develop that clotting thing and sudden death. But that becomes very famous. So everybody panics, I am having sudden death.
So doctor, what is your takeaway message for our viewers now?
Yeah. So my takeaway message would be, see, heart is a nature, God's gift to us. So once we lose the health, see, it's some well-known saying, humans, we lose health to gain some wealth. Again, we lose wealth to try to gain back that health. But the problem is, health cannot be recovered always. At least money you can try to earn, but health, once it is lost, it will never come back. So always make sure both yourself and your family, they try to stick on to a proper healthy diet and proper physical activity, and try to reduce stress as much as possible. And the sleep should be good, proper healthy sleep, and regular healthy checkup for the heart, for the general whole body checkup. And if at all, see, the main issue is always people, most of them, they don't want tablets. They say, doctor, I don't want sugar tablet, I don't want BP tablet. Then I will tell, okay, you try to do dieting and walking. If it is well controlled, it's okay. But if the diet and walking is not enough to control the sugar and BP, they have to go for tablet. The tablet is our friend, but sugar and BP is the enemy. So we should not be afraid of the friend, which is a tablet. And the diabetes and hypertension, high levels is obviously is going to kill us. So my takeaway message will be, try to strive for a healthy lifestyle, a healthy cardiac lifestyle. So you live a long healthy lifestyle, and obviously the whole family will be benefited by every member. If they are more healthy, the whole family, society, everything will be benefited. So this will be my take home message.
Thank you, doctor. Thank you for being with us and giving us a lot of information, a lot of valuable information about heart health. Thank you. So viewers, I hope this was a very informative episode. Meet you all in yet another episode of BMC Global Live, Al Hilal Health World, Nothing But Lifestyle. I am Jessila Mujib signing off. Good night.